Hi, my name is Miriam Lester, and I'm excited to talk to you today about my work with the Revive Jacmel project, in which we are building a surgery center in Jacmel, Haiti, with the help of Dr. Michael Workman. Dr. Workman, who so happens to be my boss, has been a key player in building the surgery center in Jacmel, and I have been helping him with some of his efforts. This project will have a huge impact on the poor in Jacmel by providing them with a much-needed surgery center. We have partnered with such sponsors as AGC Foundation, as well as several local colleges that have sent students down to work on building the facility. We also are working with other global teams such as Medical Teams International, Children's Hope, Restore Haiti, and the Starkey Foundation. They all help to build our life-saving surgery center. Now, the mission statement of the Life Saving Surgery Center is to provide for the surgical needs of the people in Jacmel, Haiti, so that we can make a difference, one patient at a time. The learning objectives for this presentation are to learn about the history of Haiti and the impact of the 2010 earthquake on healthcare. We're also going to be describing the pitfalls and strategies involved in building a medical facility abroad, and hopefully inspire audience members to volunteer overseas and make a difference. Now, from Washington to Haiti, it is 3,350 miles. So a lot of times we feel like we're far removed from poverty, but it has an impact on us even all the way here in Washington. As we all know, Haiti had an earthquake in 2010. It was a 7.0 magnitude and struck on January 12th. And the epicenter was near Port-au-Prince. Just to give you a geographical idea of the way this earthquake hit, it kind of hit a little bit off the coast, and as you can see, the epicenter was halfway between Jacmel and Port-au-Prince. And it had wide-reaching effects. The destruction of this earthquake, in the first 5 minutes, the entire command and control center was destroyed, as well as most of the hospitals, 80% of the buildings. Telephone, landlines, and cellular networks were destroyed, and many buildings were damaged, such as the airport control and the seaport crane. In addition, 50% of the government buildings were destroyed, leading to 25% of the government employees died in this accident as well. This led to quite a bit of political unrest at the time, since there wasn't a lot of people in power to take control following the earthquake. And the road to Jacmel was closed for 10 days. Now, the reason that the earthquake had such far-reaching damage is because Haiti is a third world country, and because of that, there are no building codes. A lot of the buildings are built with concrete construction without rebar, most times bricks, just laying on top of bricks without any mortar, which causes a lot of them to fall down quite easily, which is why 300,000 homes were destroyed in the earthquake. And there was 19 million cubic meters of rubble in Port-au-Prince, also destroying 4,000 schools. Just to give you a little bit of an image for the devastation that happened, here's a couple photos, picture of more of the slum area, and then another faraway picture of it. Now, the death toll for the Haiti earthquake was between 220,000 and 316,000. A lot of this was due to the initial injuries of the earthquake, such as people being buried in the rubble or other injuries. The remainder of the casualties happened after, from gangrene, malnutrition, and dehydration, as well as there was a cholera outbreak around this time. Between 1 million and 1.5 million were displaced initially, and even today there's about 100,000 people still displaced by the effects of this earthquake. Here's a picture of the tent cities that were built in the refugee areas just to kind of make makeshift homes. Now, the rescue and response efforts were very strong after the earthquake. 17 U.S. Navy ships, 48 helicopters, as well as 10,000 sailors and Marines with multiple hospital ships came down to help the people of Haiti. Doctors Without Borders was helping so many people that they were having to use cardboard splints and reuse their latex gloves. Ophelia Dahl with Partners in Health estimated that about 20,000 people would die each day that would have been saved by surgery. This is one of the main reasons why we've been trying to build a surgery center in Haiti so that we can give the people of Haiti a much-needed resource. Now, 6 months after the earthquake, 98% of the rubble is still uncleared. A lot of this is due to the political unrest I talked about earlier. CNN went so far as to say it looks like the quake happened yesterday. 1.6 million people were still in relief camps under those tents and tarps that we saw earlier. And it's not for lack of aid, since CBS reported that $3.1 billion was spent on medical teams and supplies, which is the equivalent of $37,000 to each displaced family. But because of that political unrest, a lot of it was not spent well, or just there was too many people to help. Since even after 6 months, there's no electricity and no running water or sewage in Port-au-Prince. Some of the health metrics of Haiti. Haiti is the poorest country in the Western Hemisphere, with only one medical doctor per every 12,000 people. Compare this to the U.S., where there's 28 doctors per 12,000 people. This causes only 7% of all births to be tended by a skilled nurse or medical practitioner, with 80% of health expenditures coming out of pocket, since most don't have health insurance, because the average person only makes about $2 a day. 30% of kids under 5 have stunted growth, unfortunately, and most don't have access to health care. Now, infant mortality rates are about 55 among every 1,000 births, which compared to the U.S. is 6 per every 1,000 births. Maternal mortality is another big problem with the health down there, since many mothers die in childbirth due to lack of access to medical care, causing maternal mortality rates to be 380 per every 100,000 births compared to the U.S., which is 28. All this is based on World Bank data. Some cultural considerations for the people of Haiti. The primary languages spoken are Haitian Creole and French. Haitian Creole is spoken by the poor, which is about 80% of the population. This language is made up of a mixture of African, Spanish, English, and Caribbean dialects. Now, on the other hand, the middle and upper class, most of the working population, which makes up 20% of the population, speaks French. Now, most people are not educated, and few people make it past primary school. And this is because even though Haitian schooling is free, a lot of people aren't able to afford basic fees, school supplies, or uniforms, causing high dropout rates. For those that stay in the school system, testing and grading can be very strict, as well as there being a huge language barrier, since most successful jobs require people to speak French. Most of the populations live in rural areas and work in agriculture, with most farming being sugarcane or coffee. But because wood is their primary energy source for the home, this has led to deforestation and erosion of the soil, which has ruined much of the farmland and the forests in Haiti, leading to unemployment rates as high as 70%. Many people have to migrate for work during the harvest seasons to either the U.S. or the Dominican Republic just to get money. Now, to avoid losing any extra money, many people live in extended family situations to share money, labor, and food. But many who are unable to afford this luxury have to live in the slums. Now, the high unemployment rate, as well as many people not making enough money, causes many people to be malnourished, and only 50% of people have toilets in their homes. Now, people in this area, the main religions are Voodoo and Roman Catholicism. Oftentimes, Voodoo and Roman Catholicism are practiced at the same time by most people. This is because Voodoo is not what most people think it is. It's actually a blend of traditional African beliefs mixed with Christian values. So it is not unusual for ceremonies to involve both rites of Voodoo and Catholic rituals. This causes many of their values to be traditional and conservative. Now, because most people are poor, pastimes include soccer and storytelling, since these are things that don't require a lot of money to do. Now, these are important considerations when dealing with the Haitian people, because you need to find a translator if they speak a different language, or figure out what kind of religion someone is to give them complete care. Here are a couple of photos from one of the current clinics in Haiti. As you can see, there are many things that can be improved to provide a more safe and effective healthcare environment for the people of Haiti. We have also included a photo in here of a mother in Haiti that we were able to help when we were down there last. Once again, to note the need for quality maternal care in the third world. Now here's one of the first drafts of the plans for our surgery center. It will consist of 2 OR suites along with the appropriate preoperative and recovery areas for safe and effective surgeries, as well as storage areas and several toilets, which are a luxury in Haiti. To state once again, we will have 2 OR suites. Surgeries will consist of general surgery based on community need. Some of our sponsors will be sending down medical teams to provide low-cost surgeries. This is huge because many of the people in Haiti are poor and will often wait till it's too late to see a doctor. One unfortunate example of this is the main surgical need in Haiti is amputation surgeries for diabetes. This is because many of those that have diabetes in the third world do not even know they have it, so it is poorly managed, and many people develop ulcers as a result. And add to that, with poor hygiene and waiting that long to see a doctor, many people have to have limbs amputated. Other surgeries involve trauma surgery following accidents. These accidents can occur in the home in the form of burns, and we will be doing simple burn grafts. This is caused by most homes have wood fires for heating. Other accidents can come in the form of farming or industrial accidents. We have been lucky to have partnered with the Starkey Foundation, which provides free hearing aids to those in the third world. This is a huge issue in third world countries since many of the cheaper medications used there from antibiotics or other medications can cause hearing loss. Here's a picture of one of our recent Starkey trips. This is a picture of the children that were given hearing aids during this trip, some of which, before this, had never heard clearly. We're hearing clearly for the first time because of the hearing aids they were given. The following video represents some highlights from this trip.
Workman. I'm from Vancouver, Washington, and I'm here with Audigy and Brandon Dawson here.
Hi, Brandon Dawson, and I'm here with Dr. Workman from Vancouver, Washington for the 2015 Haiti mission trip. We're very excited to be here.
When I think about the patients, in essence, that we've met here, I would describe them as being extremely grateful, and most of them are extremely happy. We see just smiles left and right, especially from the children. There's just, there's a lot of joy down here that we're experiencing. One of the most memorable patients that I've seen down here was a young girl who was born deaf, and we were able to allow her to hear again. I think next to sight, the gift of hearing is the most important sense that we have because it keeps one in touch with the world. I think the best part of this experience has been the expressions that we've seen on the children and the adults. In terms of takeaways from this experience, I mean, I've become that much more motivated to try and recruit both people and volunteers to come down and to make a difference in terms of helping restore hearing to everyone. From the bottom of my heart, I would like to thank both Bill Austin and the Starkey Foundation.
The first important step is getting it built. We used Oregon State students for a lot of our labor building the facility, which saved us a lot on cost, allowing us to pass the savings on to the people of the community. The first step in getting it built is getting an accurate estimate of cost, since prices for medical facilities down in Haiti can range from $70,000 to $450,000. An example of this is that Children's Hope had built a medical clinic for $80,000. Thankfully, with our partners that were listed earlier, we are fully funded through the end of this project, which is a great step into providing well-needed surgeries to the people of Haiti. Now, just some photos of the area where we are going to have the surgery center. Here's a shot of the area right after we dug the trenches for the foundation. We go down pretty deep for the foundation. As you can see, it's in a lovely area and it has very good security and is fully fenced. This next shot is actually of it mostly built with those Oregon State students I talked about earlier, putting up the roof trusses. As you can see, it is concrete construction, but we have also added in steel rebar to help with stability and prevent against more damage in another earthquake. The next one is a shot of once the roof is completely on and to see how far we've come. Now, as you can see in here, there are no windows. This is both for security and to keep the inside of buildings cooler. Here's an outside shot since the roof was put on. As you can see, we're also putting up walls around it just to give it added security. Now, our next steps in this facility, since we have the main facility built, is obtaining OR equipment and supplies from donors in the United States. We are also recruiting medical and surgical teams, and we need your help. This is an ideal opportunity for pre-med or pre-healthcare students, and we're seeking healthcare professionals, educators, and builders to help us down at the Haiti Clinic. Cost is airfare plus $800, and next time you can be joining me down in Haiti. Some volunteer opportunities are listed here. You can either volunteer with Medical Teams International, Doctors Without Borders, Operation Smile, Partners in Health, or you can volunteer like I do with Dr. Michael Workman. Donation opportunities for this facility include with the AGC Foundation, or you can donate to us through Home Depot prepaid cards. We also get a lot of our money through charity auctions, Medical Teams International, and the Starkey Foundation. Here's some of the references for my presentation, and if you have any questions, feel free to send me a message in the discussion board. Thank you for listening, and have a great day.